We're back. We lost connection. Hi, everybody. So where were we? We talked a little bit about assessments. And
Yeah.
then I think we covered that pretty well. And one of the things too that you were talking a little bit about is the importance that you feel about giving people clear cut exercises after sessions so that they can it's I think a lot of people want you just to go, you're fixed. But there's work for them to do afterwards, right?
There certainly is. There certainly is. It's a participatory process. It's a team effort. I tell people that you are with you much more than you're with me. So if I work on your neck and then I ask you to do some things 10 minutes, 15 minutes a day, it's going to potentiate your recovery from that numbing in your arm and neck. Why would I would never want to say, oh, just come and see me, darling, and come on in and I'll fix you, honey. Let me be your I don't, you know what I mean? It's a patriarchal type of therapy that I don't care for at all. This is client-centered. This is client participatory. And if you don't do your homework, then I have been known to refer people out. And I tell them that because that's how important it is. Because literally, the most important thing in your recovery may be the things that I show you and encourage you to do on your own daily, every day, more than what I am able to do for you, or at least as much. So we are a powerful team that we're together, and if we're not together, then it's less powerful. So that's where I'm coming from.
Yes, I think it's really hard I think the expectations sometimes for sessions are way up here, and people want a lot done without any effort on their part, and that's just a losing battle. So I love that you show and you have exercises prepared.
I can't help but make this comment too, Diane, because there are 2 states in our country, and you're not in one of them, that says their state law says that massage therapists should not be engaged in promoting or recommending any type of remedial or rehabilitation exercise for the muscles of their client. And I say that's the silliest thing I ever heard, because here we are. If we know anything, it's where the bicep muscle attaches to the body up at the insertion and also at the origin. We need to know those things, and we do. So if I say to you that what I would like you to do, or the neck, we know the motions of the neck, we know the muscles that do them. And if I say to you, Diane, that I'd like to see you doing some simple rotational work and simple, easy range of motion work between your session, that is the most logical thing that I can think of possibly. And people who would say, well, my gosh, that's not in our scope of practice, is it? Well, it totally is. Have you been to Barnes & Noble and seen the exercise section of books that you can pick up and read? And if a personal trainer can give exercises with a weekend training program or 2 weekend training program, then a massage therapist with 500 to 1,000 hours of training certainly can show a person how to take a muscle and either flex it or extend it. It's not real difficult,
Right.
So I say categorically that if we are not recommending things for our client to do at home, and that means exercise, and frankly, here's a funny little thing that turns out, you may get a kick out of this, that let's say that you have a restricted neck, and that's possibly causing that numbing and tingling down your arm, which it could, because numbing and tingling in the hand or fingers implies something between the neck and the finger. We don't know where, but somewhere in between. It doesn't mean it's in the finger. It doesn't mean it's in the neck either. It means that we don't know, but we have a good idea of where to look. And that's what we do. So guess what I would be instructing you to do in my clinic, in my office, if you were to say, well, gee, David, that was a nice session. What should I be doing anything at home? And I would say, yes. Do you remember those 4 movements that I had you do when you came in? And you say, yeah, I remember those. Okay, those are the ones that I want you to do.
Right.
I want you, not a stretch, not this. That's not what we want to do. For that, we want to do it nice and easy, within the range of motion, no pressure, nice and easy movements to restore the movement that has been lost, to give that message, if you will, to the nerves that supply the muscles in that area, doing neuromuscular rehabilitation, if you will. and myofascial along the way. So those are literally the 4 movements that I would give you. And you say, well, that's pretty interesting. You use 4 movements to assess me and then give me the same 4 movements to increase my range of motion. Why would I do that? That would be because it works. Because it works. Along with hydrotherapy, I'd be instructing you to use heat on your neck. And if you had pain, I'd be instructing you to use ice for that. So we're totally involved in the use of hydrotherapy in treatment, along with remedial exercise. Yes.
And then one of the things that's really different about your approach, from what I've seen out there, is you say no thumbs.
Well, now that's what's different. Let's be clear, and I'll get to that. I don't have any thumb work in my training, at all. No thumb work, because that happens as I've aged, and I started out using thumbs for everything. And I mean, it's not just the direct pressure of the thumbs. I use that sometimes too, but the turning of the thumb and the pressure that you do and all kinds of weird motions that really bake them pretty well, and they did in my case. But you said that's what's different about our program. What's similar of our program to some others, and that is we teach clinical therapy. Become a specialist. And now beyond become a specialist, and in addition to that, David is aging, and David doesn't have the strength that he used to, so he's had to recreate himself numerous times to continue to do good work and get good results. So over the years, I've gone from a standing therapist, moving people around, doing Tai Chi and all sorts of big body movements. I did it for years and years and years until I had a back injury, and I want to continue. So that's when I began to do things like have my client in sweats and a t-shirt and have them on their side. And I would be using a lot of forearm work, lots and lots of forearm. I don't mean the point of the elbow. I don't recommend the use of the point of the elbow, but the forearm, yes, it's a wonderful instrument for us to use. And it got to where I couldn't use thumbs. And so I couldn't honestly go into a classroom and continue to tell you how to use your thumb and do this work if I couldn't do it. Mm-hmm. Now, why would I do that? So I just came clean and took all the thumb work out of my manual. I'll let others teach the thumb work. And there's plenty of folks out there teaching using thumbs. So I'm saying if you take our program, you can use the same approaches, but you don't have to use your thumbs. You can use our thumb saver. And I did not set one out to show you. Yes.
But again, like back to the point, I think underlying in our whole conversation, which I really love, is that in order to continue doing something that you loved and that you really believed in, you dove in and learned as much about it as you could and what interests you, and you dabbled in that. And then as your practice grew and you grew as a person, you adapted to that. And as a leader in the field, some of us are leaders in the field, and it's our almost gift or duty to put together classes and help people, and there just are. And so you've really put together almost like we've traveled with you here to where you are now. And so no thumbs. And then you also too, you leave clients closed, and you have good reasoning behind that too, which I thought was interesting. And like I said, I love learning about what people are doing, because we're all up to some good stuff, I think, for the most part, right? But yes, doing what works for you. And it's just really cool, David, to hear how it all kind of came together for you. So thank you so much for sharing. And now tell me about the clothing and the sideline. How did that start?
Well, it started with athletes, because when I'm working on the Olympic training track with athletes doing massage before the race or after the race, whatever, they're not going to take off their clothes and literally expose their hamstrings to a cramp from a cold breeze. So it's not going to happen. And so I had to learn how to keep the athletes warm, or if they came to my hotel room at night before they meet the next day and there were 6 of them sitting around, you can't have a person undressed and then get on the table and try to keep them covered. They're 19-year-old athletes. My God, it's very, you know what I'm saying? They're 19 right. years old. So keep your clothes on, for goodness sake. We want to get some results here. And what I did, I took that back to my practice and started talking to my geriatrics about it. And some of them were surprised. But what I would say is just, let's try it. Let's give it a try. You're dressed, you got your sweats on, you got a t-shirt on. Don't have to take it off. Just get up on my table. And side lying is so neat because you can do so many things in side lying. And then I might use my rolling stool and just sit there and do a treatment and say, man, that was the best back or neck or whatever treatment I've ever had, because you focused on it. You weren't trying to do a full body. You didn't feel compelled to touch every toe or finger. You focused on what I'm having problem with. And I've got 3 good massage therapists who do a nice massage, but you're the only one that takes the time to dig in, and not dig in, but you know what I mean, to delve into my situation and help me thoroughly. So that was enlightening to me.
And you keep throwing out these little morsels in your conversation too. It's like too deep doesn't always mean must put this as far into someone's body as humanly possible without breaking a bone. Right?
Never.
So, right.
Never. The proximal 6 inches is our strength. That's where, and not up here, that's not any good either. But right in there, the proximal 6 inches is where I want my students to be. I want them never to lock the arm like that and use that, but always keep it bent at 90 degrees.
You'll probably hear little squeals, and you'll notice people's gluteus maximus, minimus, and medius squeeze up when you do that.
It could happen.
When you use that elbow.
It has happened. And that's when they, and pressure on a tight muscle is not going to be of any assistance at all.
So you have, like I said, evolved with time, and then no thumbs, closed, sideline. So
my market, literally our sub-market, our market is anyone who wants to be in clinical practice. Anyone who wants to be or wants to stay in clinical practice, they would want to investigate our program. And anyone who's been at it for 5, 10, 20 or whatever years and is having problems with their thumbs and so forth, this is a program that I don't know that anyone else is offering these kinds of things. The closed on, the sideline, no thumbs, the wonderful tools that we have to help us and doing clinical work. Because it doesn't take very long. It doesn't take a lot of effort to treat a neck and a back and then have them get off the table rather than having to do that full body as well. It's liberating quite a bit.
Well, congratulations on I just think it's so cool how you've grown and continued and established these awesome classes. And I have to ask you, just because I feel like you're like a real heartfelt kind of man, which is awesome. And what were some of the greatest experiences that you've had as a teacher? What are some of those moments where you're like,
well, it has to be that, literally I figured out long ago that I couldn't treat all the pain. And so I wanted to train other people to do so. And the greatest joy of all is to hear a person, a therapist, say what their clients are saying about their work. When a student, a graduate of our program, can say that a person told them that they have done no one else has ever done, even though they've had some wonderful massage, wonderful therapists around the world perhaps, but no one has ever done that. And I like it. When I hear that, I know that I not only have been effective in the clients I've treated, I know that, but I also get the distinct joy of knowing that it's passing on, that it's duplicatable.
And I think that's one of the reasons I was so drawn to you, is that you can feel the passion just oozing out of every pore of your being. And it's just so beautiful. And thank you again for all your...
We all are miracles, Diane. We all are miracles. And I will tell you a quick story that illustrates your point.
Okay.
One time a therapist called me from, I think it was Berkeley, California, and said, David, I've been a therapist for 25 years. I'm 62 years old. I've taken lots of courses. Why should I take your class? What am I going to learn? And I said, well, the anatomy will be the same. The assessments will be the same. The remedial exercises will often be the same. The hydrotherapy will be the same, but I am a collector. And everyone I've ever studied with and everywhere I've ever been, I've collected techniques, approaches, twists, turns, angles, different ways of getting the job done. And I said to her, if you're any kind of a collector, then you just can't resist coming to see my collection. And she said, you got me, I'll be there.
What a great way to put it. That's one of the things too. I just
That's really what it amounts to. I don't claim to be unique. I'm teaching classic anatomy. I'm not making up things as I go along. I'm teaching classic training, classic things, and then everything we teach, every modality that we teach. I'm not a clone of any particular approach. We do joint mobilization, and we do myofascial work, and skin rolling, and trigger point, and all manner of pin and stretch, and everything you can think of that is good, known to be really good for the body, with hands.
So, I'm done our list of things that we go over. I just want to know what you want to leave us with.
Well, what I'd like to leave you with is still the possibilities. We haven't even begun to reach our potential. We have not even made a good start in reaching our potential to be of great assistance to clients who are staggering around, wandering around, stumbling around with all kinds of limitations. We have not yet even reached any kind of a zenith. There is much work to be done. So much work that I can't get it done. And I'm hoping that those that I can train and others can train that can move what massage therapy can be into reality. It's still becoming. It is still a becoming profession. And I'm tired of being called a trade. I'm tired of being called a masseur or a masseuse or whatever, other than a massage therapist. I've promulgated the use of the word therapy for 40 years, and I'm still at it. Mm-hmm. Still at it, of talking about us as massage therapists.
It's so true. It's like, I thank you so much for saying that. And I thank you for your passion, because it's definitely one of those things that, the way that we're viewed, I don't think is, on the level that of respect that we really do deserve as a group. We're moving mountains, and, we're helping a lot of people out there. So I'm so thankful that you took the time. I'm very honored. I feel how big your heart is, and I feel how big your passion is. And, your classes sound amazing, and I'm just so thankful. He's also Hall of Famer, so please, you guys.
And by the way, the way you say my last name is not Morin, but Morin.
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 Morin. And so David is here with us, and please, I would encourage all of you to check out. I'll put up his website and all his information. If you haven't already checked him out, I know a lot of people were eager to tune in and hear what you had to say. If you have never taken a class or checked out his site, I'll be posting that so you can and you should. Sound good?
That so we're gonna. Me, Diane.
So we're gonna log off. David, if you would hang tight, I'm going to just chat with you for a minute at the end here. But everybody, thank you very much. This will be posted for a couple of days. Watch it. Check out David's stuff. And I think you should take a class personally. So
I think they should keep asking questions.
Huh?
Keep asking questions.
Keep asking questions.
Ask us questions.
Yeah. Bye, everybody.
Bye.